Okay, one of the viewers asked if we would explore restless leg syndrome and come up with some techniques or procedures for that. And what we're going to do is we're going to talk about that. It usually takes about 6 months to develop a technique or procedure, and it begins with wanting to find a way to work with a syndrome or situation, and then figuring out which stones to use, and then testing. Once I've got a formulation that seems to be working, I then check that on a few different people, see if I can get consistent results, and then I ask others to try the same stones and techniques and procedures to see if they get consistent results when they do that. Now, I'm exploring some options for restless leg syndrome, but Linda is not the person who has restless leg syndrome. So here's one of the problems: is you can only test a stone and what response it will get if the person has the issue. If someone doesn't have any inflammation, you're not going to feel the stones addressing the inflammation because there's nothing to address. And because Linda doesn't actually have restless leg syndrome, the only thing we can do is make a theoretical list. So if that viewer would be so kind as to test out what we try here and let us know how it went, that would be excellent. And anybody else who is experiencing restless leg syndrome, if you could try it out too and let us know. So you can always write to us via YouTube. You can put comments, or you can write to us via the community tab. So what we're going to do is look at using certain materials and why. So the first thing that I did when I saw this request to come up with something for restless leg syndrome is I went and did some research on restless leg syndrome to see what the current state of knowledge is. Now, over 30 years ago, when I was still living in South Africa, I had a client who had very severe restless leg syndrome, and I was able to help him with the Alexander technique. But that's not the question now. The question is, can we help restless leg syndrome with crystals? And so I'm going to put together my experience and knowledge. That wasn't the only person who has restless leg syndrome. It's quite a common and unfortunate situation. But what I do know is as the nervous system winds up, the issue gets worse. And what is restless leg syndrome, if you don't know, is that you're lying in bed, exhausted, and your legs have to move. It's a compulsion. There's something inside your body that's making your legs move. And what that is what we have to quell. We have to quell that impulse for the legs to move. But in order to quell it, we have to know what's causing it. What is the genesis of this? And so I went and looked it up online, because that's, of course, the easiest way to get this research information at this time, and found some interesting things. So let's combine what I've found with my research with what I know from my experience, and all we're going to do is make a list of what could be tried. It's an experiment. It has to be tested, and it has to be built into a procedure. And it does make a difference what sequence you do things in and how you combine the stones. And all of that takes time to research. This is step 1. So the first thing is that the nervous system gets more and more wound up. And so the stones for unwinding that tension that's building inside the nervous system, the 2 stones that will help very well with that are amblygonite and larimar. So I have those to put under the hands. And here is amblygonite. It's a beautiful yellow stone with a slightly green aura to it, I would say. I'd call it an aura. Sometimes I feel like I'm looking at a yellow-green stone when I look at my amblygonite. It is a beauty. I'm very lucky to have this stone. And then I have a slice of amblygonite as well. And I'm going to put that on the solar plexus chakra right over the vagus nerve, because I'm pretty sure that the vagus nerve could do with some relaxation and some calming and some serenity. Well, Linda, you might not have restless leg syndrome, but that helped you, didn't it?
Mm-hmm.
Very good. Yeah, excellent. Okay, and then this is the Larimar. Larimar is the stone of serenity and tranquility. And you can see I'm wearing Larimar around my neck today. I love this stone. It's like a work of art. But Larimar is like that. It's just gorgeous material. And it comes from one place in the world, the Dominican Republic. And it's called a pectolite, whatever that exactly means. And that is meaningful to some people. That's the reason for saying it. I'm going to move this up and actually turn it around if it's asking me to. And that's because I'm going to use shungite here, the good old shungite. Right, now, the next thing that I found out about restless leg syndrome is that it's an iron deficiency, seems to be implicated. And so the stone that's going to bring iron into the energy system is, of course, hematite, because that is iron. And the problem with the iron deficiency is that it's not that the person's not getting enough iron in their diet, but that their bodies are not metabolizing the iron correctly. And for that reason, don't just take an iron supplement. What you want is an iron supplement that is probiotic. And I know when I was pregnant, I used Floridix because that was biodynamically grown, and the iron was fed to the plant, and then the plants were used to make the iron tonic. And therefore the iron was in a very ready form for the body to assimilate and absorb the iron. And that's what you want. And specifically what you're needing is that the iron be able to cross the blood-brain barrier to get into your brain, because that is where the iron is needed. Because the other piece of restless leg syndrome is that there's a dopamine deficiency. And that's because of a lack of iron. So it's this chain of events that needs to be addressed. And so therefore I am going to grid with an iron oxide crystal, which in other words is a hematite coated crystal. And I have this absolute fabulous one that I got in Tucson now. And it's actually an Isis crystal. It's double terminated. And I'm going to grid with this to inform the body to open up to iron. Open up to iron. I'm going to grid the entire energy field. Linda, this is meaningful for you, this iron oxide.
That's what I was just wondering.
I wonder if you need a little dose of iron. Because you can feel this, right? It's strong.
Yeah. Yes.
Interesting. And you see, this is where if you had restless leg syndrome, I'd be able to check whether this generates a response from your energy system saying, yes, yes, that's what I need, or nothing, but you're generating a yes, yes, so that's...
I feel like it's creating like a little bit of a heaviness.
Yes, well, of course, this is one of the heaviest stones. My poor arm is already going, how much longer are you going to do this? And it's a substantiality that it's very powerful in that regard. So there we are. That's that stone. I'm going to let you feel how heavy it is by just putting it there.
Oh my gosh. Wow.
Isn't that?
That's a weight.
Yeah, it's interesting. Actually, I'm going to put it there so that it can feed its energy into the energy system. And I'm also going to use this double terminated tangerine nemurium that's coated with whatever this coating is. As I say, I think it's calcite. And I'm going to put that one here. And then also, because we're actually talking about iron in the brain, we're going to use our hematite coated amethyst, and I'm going to put it up here at the crown chakra. And I'm going to rest it there, and if it gets uncomfortable, just say. Now you see, that feels very strong and safe. That's interesting. Certainly you're responding to it. And this is where the trick is. I don't have someone with actual restless leg syndrome, so I cannot check that it's meaningful for that. But I'll still show you how to experiment for yourselves. All right. The next thing is that what I noticed with people with restless leg syndrome, and it's not hard to notice, is that their leg muscles are unbelievably tight. And that's because the neural pathways to the legs are under constant, it's kind of like an assault of this impulse, this nerve impulse that the legs must move. Well, for the legs to move, the muscles have to engage. And so, of course, the muscles of the legs are overworked and overexhausted and overtired. And so that's where I think I would begin, is to get that tissue, the muscle tissue, to relax. And I know that it is very profound via the Alexander technique, but in crystal work and in crystal healing, we're going to use amazonite and golden azeztulite or golden quartz. So these are two of my very favorite stones. The color of this amazonite is so phenomenal. This is the golden quartz. I use these two together, and it does help with muscle tension and muscle spasm as well. And then, of course, when we're talking about muscles and the behavior of muscles, then magnesium becomes interesting. And magnesium is also important to take if you have restless leg syndrome. And in the meantime, with the crystals, what you can do is get the muscle tissue to release. Now, this is also good for you, isn't it? Wow.
Mm-hmm.
Yeah, well, of course, you've got the knee thing going on, haven't you? So this will be helpful. So this is done via infusion, and it works really, really, really well. And I can feel this going up into your brain. I can feel it affecting your neural pathways. So I think now we just need someone who's actually got RLS to test that out. Good. Side. You need this, Linda.
Feels very grounding.
Yeah. It really helps. So that's for the muscle tension. And then for the nerves and the nervous system, because it is an issue in the nervous system, restless leg syndrome. So raphanite is the very positive material to use for that. But also, I don't have it here with me, aquamarine. We'll get a piece of aquamarine because we'll finish off with that. So take your seraphinite, and I think in this instance you're going to want to use shungite as well, because I did say earlier that it's about iron metabolism. Well, the stone that helps cellular metabolism is shungite, and it is because it helps the cell membranes to work better, and therefore definitely you're going to want to use shungite in this process. So let's use shungite and seraphinite together while we do this, just demonstrating which materials to use and explore and experiment. And this seems to be lovely as well, doesn't it?
Mm-hmm. Yes. Feels so good. You could just keep on doing this for a long time.
Oh, never mind restless leg syndrome. Just do it. Yeah, there's nothing to stop all of you exploring this to see what the effects are. There is not one thing here that not everyone could use. Isn't that so? I mean, that's what we're really finding out, aren't we, Linda? That Oh, this is just a really good workout.
It's like a really nice massage.
Yeah. Well, see, the seraphonite was the first one that I used ever for a first layer infusion, and everybody was like, what is that stone? And everybody then wanted a seraphonite sphere. And I remember we began with a different shaped seraphonite. I mean, this was like in 2007 or 2008. And then we discovered the sphere is the easiest form to use. And of course, you can't get seraphonite spheres so easily anymore because the deposits are much smaller and they can't afford to make a sphere this size. The spheres are about half the size now if you can find them. Seraphonite's one of those stones that only comes from one place. Oh, your arms need this, right?
Yard work yesterday.
Oh, yard work. Over engagement of the tissue, yeah. But see, this isn't for relaxing the muscles, it's for relaxing the nerves. So it's interesting how it works. But you know, we've got two things. We've got the musculoskeletal system, and then we've got the neuromuscular system. That's kind of dumb. Where's the neuromuscular skeletal system? Why haven't... when we're going to talk about that, because that's in fact what I'm always working with, is the neuromuscular skeletal system. And they mesh together in such a powerful way. And yet we don't even have the words, the correct words. Gosh, look at this, how it's getting into your tissue. Linda, you're going to have to thank our viewer who asked for restless leg syndrome. This is very meaningful for you. Now this is interesting because you've seen me working with 2 shungite spheres on Linda. And I'm telling you, changing it up and combining the seraphonite with the shungite has given us another layer of depth in working on Linda herself. Never mind a demo for anybody else. So there, we both just discovered something that's valuable. That's good. Doesn't it feel rather interesting?
Mm-hmm. Like I just had a nice relaxing massage.
And you're...
But energized.
But energized, I know, not limp and sort of flat and tired. I could do this. It's energizing me to do it for you, so that's pretty cool. Okay, so that's that. And then also what we want to do is adjust the hypothalamus and the pituitary and the pineal glands, because that is going to help with the dopamine reception in the brain. And I can't explain the exact sequence for you, but do go and look it up. It's there. You can easily find it on the internet. So I'm going to come up here to the crown. And to do this, I use 3 main stones. I'll work with them together. So this is a kunzite needle. It's the first piece of kunzite I ever purchased. We went down to Arkansas and we bought it there. I don't even know what year that was. Maybe 96, 1995 or 1996. I got this kunzite, my very first not quartz stone. And then moldavite, and this is a Besset Nice moldavite needle, which is now worth an arm and a leg, and my zincite needle. And those are the 3 stones I'm going to use. And I use them in tandem, and I also need a bowl. So I'll put my bowl there. I'm going to ask which ones shall I begin with. And I'm supposed to begin with my kunzite and zincite. I'll put my moldavite down. And I ask the spirit guides to lift the hypothalamus up into the energy field, so it's somewhere in there in the brain. And I lift that up. And, oh, this is meaningful here. And I start to prod the hypothalamus and go inside. I dig the kunzite needle inside, and then I dig the zincite needle into the hypothalamus. And the guides are actually holding the organ and the gland up in the energy field. That's it. And I'm just going to go around and poke it like that. This is also meaningful for you, Linda. I don't know why that is. It's because you're at that time of life where you get so much stress, and the hypothalamus just needs this when it's under stress. There we go. Now that is very meaningful. Right. Once you've done it with the zincite and the kunzite, then you go with the kunzite and the moldavite. And you use these two. That's it. And again, you just work with the one going into the gland, and then the other. And then I let the guides replace the hypothalamus and now the pineal and the pituitary. And I just ask them to pull them up in a slightly different position so that I can work with them. And this is not space accurate. It's not like an accurate map. I just like them to pull it up into the energy field so I can work with it. But of course it's somewhere in there. I'm not going to go and work down at the feet. I'm going to have it be in the area and in the region. So I need my zincite and my kunzite, and very easy to lose my moldavite on this green cloth, so take care of it over there. So we're going to work here on the pineal, and I'm going to go a little bit more quickly this time because I can. And then the pituitary. So I'm just getting them spatially arranged so that I feel like I know what I'm doing. That's it. And then put the zincite needle down and I use the moldavite. And then I'm going to ask the guides to replace the pituitary and pineal glands. Pituitary and pineal glands. Getting a little tongue-tied. Okay, very good. So for the last thing that I'm going to do in this experimental layout, as I think I can call it, is I'm going to go and get an aquamarine lingam and an emerald lingam to bring deep relaxation as well as calming to the nerves as a finishing movement. So let me go and get that and I will be back. So here I am. I went to get my aquamarine lingam. That's that one. And my emerald lingam. That's that one. And while I was there, right next to them were these beauties, my moonstone lingams. And they said, don't forget us. So definitely, yes, whenever it comes to anything to do with both muscle tissue and nerve tissue, hydration is key. And moonstone is what's going to help you with hydration. So very, very true. Don't forget the moonstone. It's kind of like the shungite. Shungite and moonstone, ubiquitous. You want to use them almost everywhere in every session for almost every reason. So there we are. So first we're going to use the aquamarine, that's that one, and the emerald together to calm and soothe everything, and then we're going to finish with the moonstone since the moonstone reminded me. And here we go. Let's start with the emerald, aquamarine, emerald. And there we go. Ooh, that's also meaningful. Wow, that deep relaxation is really helpful, isn't it?
Mm-hmm.
It's got me in a different mode as well. I'm going much more slowly. Nice. And I tell you what, this combination, here's what's going on as well. The combination of the aquamarine and the amblygonite on the solar plexus is having a profound effect. So I'll put my hand there and hold those two together and work here like this. This is the thing, you have to be very lively in the moment, very attentive to feeling what's going on, what the responses are, so you can follow the energy and support the energy. Nice. Wow, Linda.
Yeah, that's very nice.
And you're just feeling these deep, deep, deep releases going on in your neuromuscular skeletal system. I tell you what, I think this is worth trying if you've got restless leg syndrome, because I do feel a difference between the way the muscle tissue and the nerves and everything behaving. I can feel a difference in you. So the other supplement that is quite a good idea to take if you have restless leg syndrome is vitamin D3. And actually, folks, it seems like vitamin D3 is the cure to all ills these days, or the supplement for really putting you in a different place. So I'm hearing vitamin D3 being recommended all over the show for all kinds of dynamics. So you may want to look into whether you need vitamin D3. It's no use taking vitamin D. You have to get the vitamin D3. Gosh, I'm so glad this person asked these questions. It's just getting this combo. I've never had this combo come forward before, the aquamarine and amblygonite. Then together with the emerald, it's profound, isn't it? I can't even speak, it's so profound. Nice. Right, I'm going to see about this. This is profound too. The combination of the emerald and the amblygonite. Give it a stronger connection. I found that if I keep my stones together, they connect, and the energy flow between them is very strong. And then you put your hand on top, and then that also, remember the warmth from your hand as well as the slight pressure, it also activates the stones quite nicely. Oh, this really is worth exploring. Wow, wow, wow. Thank you, viewer, for your question. So what we've done today is just make a list of stones and procedures that are worth exploring for restless leg syndrome. And of course we'd want to think of a few more, and then we want to systematically research it. And everything needs to be documented. You have to make lists, you've got to write it down, you've got to write down the comments and the observations. You have to be very systematic when doing research, and we can't do research in the true scientific manner of double blind and having placebo research as compared to researching the actual material. We can't do it. We can't do it that way, and we just have to accept that. We have to do the best we can, and I tell you what, if it works, that's good enough for me. Not if it works once, if it works again and again, consistently. good. Now, I'm going to put that back there and just go over the crown chakra with the emerald. This. Well, let's use this lovely emerald lingam here on the crown and third eye just to integrate the other work we were doing. And because this is super relaxing, and I tell you what, if you can relax, that's going to help restless leg syndrome tremendously. There's a lot of tension involved, and it's nervous system tension, which of course then gets communicated into the muscles. Alexander said all tension manifests as physical tension, and if we're talking about physical tension, we're talking about muscle tension. And if we can get everything to relax, we're in a completely different place. And if you can relax before going to bed, deeply relax before going to bed, you will not have such a tough time at night. You will find that it's when your nervous system is overstimulated that the restless leg syndrome is at its worst. There we go. It's that interplay between emotion and psychology and actual physiology to do with enzymes, hormones, vitamin deficiencies, whatever. These things all tend to go together. In some of the ways we can research, and some of the ways are we have to just do the best we can. But definitely, if you can relax, you're going to be feeling better and you're going to be doing better. And there is nothing like emerald for inducing relaxation. Very powerful. Right, so that's a little bit of emerald action, and now let's finish off with the moonstone. I'm going to turn this back around in this direction. And we'll start here. Oh yes, that's delish. And this is now a finishing move.
Kind of tingly, giving me chills. Definitely waking me up.
Oh, well, just in time to tuff you off the table. Very nice. And there we are, just lovely. Thank you very much for that question about restless leg syndrome. Those are some ideas to get started with. Thank you.